Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith-Rogers. Vaccine hesitancy is front and center of the conversation about childhood vaccination. But what about pet owners and their beloved four-legged friends? Johns Hopkins veterinarians Meghan Davis and Kaitlin Waite talked to Stephanie Desmon about vaccination rates in pets, why certain infections harm their humans too, and the burdens on doctors who have to convince pet owners to stick with the vaccine schedule. Let's listen.
Kaitlin Waite and Meghan Davis, thanks so much for joining me.
Such a pleasure.
Thanks for having me.
So today I want to talk about vaccine hesitancy, but in pets. Now, the pets aren't the ones who are hesitant, but I understand that this epidemic of vaccine hesitancy is impacting veterinarians and their patients because it's moved into the pet world. Meghan, what can you tell me?
Well, certainly, since I was in practice, this always has been the case, but in typically much smaller pockets. And I will say, occasionally you do get a hesitant pet too. They usually manifest it in a very different way than the owner does. But nowadays, we see that maybe even up to a quarter of our pet owners may have some degree of vaccine hesitancy. And when you do see it, you'll sometimes see that owners will just not get most of the vaccines, but they'll still get a vaccine that could be required. For example, there are some states that require a rabies vaccine, and that is as much to protect the pet as it is to protect the owner, because rabies is a disease that's transmitted from animals to humans, and it's nearly always fatal. So that's a really good reason to at least get that one vaccine. And so what you'll see is that some owners may just get that one, or they may express concerns about vaccines in general. And then it is up to the veterinarian and that veterinary patient-client relationship to kind of walk them through the options and make sure that we try to get as many of the more critical vaccines on board as possible, whether that's for human health or for animal health.
Kaitlin, are there a lot of vaccines for pets?
Wouldn't say that there's a lot of vaccines for pets. The requirements, like Meghan mentioned, vary state by state. There are a few that are highly recommended because of pet health and public health, like rabies being one of them. In this area, we consider lepto to be one of the major ones that we would like to advocate for vaccinating because it's a disease that's seen predominantly in the East Coast. And there are various others. It really depends on that veterinary client connection and communication and what's required by your state.
Has this, Kaitlin, become more complicated as time has gone on? I know that vaccine hesitancy now seems to be everywhere.
More complicated is an interesting question for me, and I would defer to Meghan on how she would like to add to my statement. I would say that in terms of vaccines, it actually hasn't become more complicated because vaccine technology has advanced. And so we've been able to extend recommendations for boostering from 1-year vaccine boosters to 3-year vaccine boosters, which really alleviates some of those concerns and makes it so that those trips to the veterinary clinic are less frequent and those vaccine interactions are less often. But I will say that public perception of vaccine has changed, and that can increase not only complications or concerns, but then also the burden of the workload and mental health and well-being of the veterinarians that have to deal with these kinds of interactions on that client-veterinary relationship.
I think you said it really, really well. We want to emphasize that if you have a pet, you should be going to your veterinarian at least once a year for that annual examination, which is critically important. And yes, if there are vaccines that are due as part of the routine schedule, that will occur then. There are both core and kind of like extended vaccines depending on the pet. For example, one of the things that we might recommend in dogs that go outside a lot, maybe go hiking with their owners or go camping, maybe a much larger suite of vaccines than we might recommend for that, pampered Chihuahua who pretty much stays in the purse when he or she goes outside.
What are people, Meghan, afraid of when they are choosing to delay vaccines for their dogs, and what could the consequences be?
That's a great question. And what studies have shown is that the reasons may be varied. Some of them are the kinds of reasons that we hear a lot more these days with regard to human vaccination, mistrust of the vaccine, or there may be misinformation about the vaccine effectiveness or need for it. But we also see that cost is a really big issue related to whether or not people get the vaccine. And so what you'll see are, for example, some states or local municipalities or animal shelter control organizations trying to stand up lower cost vaccine clinics to help to address some of these, especially for those vaccines like the rabies vaccine that might be required.
It's hard to shell out that kind of money, even though it's vital to their health.
Absolutely. And one of the more interesting things about veterinary medicine compared to human medicine is that it really is completely open, right? Most pet owners are covering the costs related to their pet's healthcare. Whereas on the human side, what we see is that insurance companies are a much bigger piece of the puzzle and that most people are not having to navigate those trade-offs. So the fact that we see some of these kind of vaccine hesitancy trends in parallel does, I think, point to more than cost being really important for us to consider as we move forward.
Kaitlin, there's been a false link between autism and vaccines in humans. And when I was doing some research, I did see the word pautism. I wonder if you could talk to me about what that is and what it isn't, and if those are the kinds of concerns that people have.
I'm not an expert in pautism. To my knowledge, those kinds of links between vaccines and pautism are not founded in science and are more founded in people's perception of vaccines kind of risks. But I would like to state that people and clients' concerns about vaccines are valid. And it might not be pautism, but vaccines do cause reactions. And there are some serious ones that can be caused in cats, for instance. They can get site injection carcinoma. All of these reactions are extremely rare or very rare. And again, because of how we've developed vaccines over time, have become even less so concerning. But that's not to take away that people should have concerns, and it's okay to have these kinds of questions. Pautism might not be where I would start. But if it's a concern for a client, then it needs to be addressed with science-based kinds of concerns.
I wanted to ask you, Kaitlin, you've been doing some research talking to veterinarians. I'm wondering if you could tell us what you found.
My recent research is looking at veterinarian animal care workers' mental health and well-being relates to occupational risk factors and barriers to that. And it's been a qualitative study so far. So I've been doing a lot of interviews with veterinarians and animal care workers. And what I found is that a lot of the concerns that veterinarians are expressing come up with kind of aligned with this vaccine hesitancy in terms of, Meghan mentioned the cost of things. Cost has been a major barrier for, I guess, that client and veterinary relationship because it's something that adds friction to it. And then it adds burden to veterinary well-being. And how do you get over that as a veterinarian or a manager or practitioner in terms of making sure that you are keeping the lights on and providing the best care and, affording your veterinarians, but then expressing that need to clients so that they feel like they're not just, giving these kinds of recommendations to profit from them directly. And I feel like that kind of concern has been within the profession as well as others like burnout, compassion fatigue. I mean, we're talking about vaccines that are used for prevention of diseases. And when you have a client that doesn't understand that and is hesitant to it and might make you feel like you can't provide the best care for that pet, that's going to weigh on you as a veterinarian. And so these types of issues not only impact the animals, but it impacts veterinarians' well-being and also has that overarching public health concern because now we're talking about, who's getting the rabies vaccine and who's not. What's fascinating to me is some of those unique factors that really haven't been identified in other studies before. And when it relates to that client-veterinary relationship, I'm very preliminary work, so I feel hesitant to say, but some trends that I see is this idea of client satisfaction as a performance indicator for vets. And that can be really heavy, especially for our new vets. Client satisfaction and that feedback that they get from their clients, they're using it as an indicator for how good of a vet you are. And you're trying to do the best that you can. You're not always going to get a happy client at the end of that.
Mm-hmm. I mean, these are their babies, right?
Yeah. And I will say that we talk a lot about trends in terms of vaccine hesitancy and people's perceptions of the necessity for vaccines in human and animal spheres. And I would just like to point out that this is also kind of like the positive side is that it really highlights the importance of that human-animal bond that often gets kind of poo-pooed or downplayed. But our human-animal bond is strong. And so when you're making public health recommendations or when you're thinking about disaster relief, thinking about pets and veterinarians' role in those kinds of decision-making is very important. And this is kind of where it comes into play.
I think that's such a great point. One of the other pieces of this that many people may not recognize is just how much trust a lot of people have in their veterinarians, maybe compared to other healthcare professionals. So we are among the more trusted. And what you'll see is that when you have a high level of trust and when you have longer term relationships between a client and a veterinarian, that's where you tend to see better vaccine uptake and, more frequent visits. So there are a lot of positives to pull out of this.
So as a public health issue, it's not just as simple as protecting the pets themselves. It's about protecting all of us, right? If pets could be the weakest link here in disease dissemination. Meghan?
Absolutely. And one of the things that I think we need to focus on more is how we do better integrated care models. There are some out there, and what integrated care from like a One Health perspective, that means thinking about the people, thinking about the pets, and thinking about their shared environment, is that you can actually sometimes get people who are hesitant to get healthcare for themselves to participate in healthcare more routinely when you're also providing care for their pets. And it allows you to do two things. The first is kind of like that gateway that you're bringing people in for healthcare services who may not have come as routinely because they care about their pet, right? This is a furry child and they want their pet to be cared for. But in order to have their pet cared for, they need to at least have a consultation, right? A chat with a person. And that can then lead to access to healthcare services they may not have had. And then the other piece of it does relate to those elements that do cross over, not just the zoonotic diseases, those that can spread between people and animals, but also things that may be caused by shared environmental exposures. We've mentioned cancers can come out of environmental exposures, asthma and respiratory disease can come out of environmental exposures, and this can allow for more integrated interventions too that might benefit both the pet owner and the pet.
I'm trying to imagine what you're saying here. Are you saying that you've got a veterinary clinic that has a nurse for humans as well?
Or vice versa, that you have veterinarians that are participating in other kinds of healthcare delivery models for people. There are some times when you'll see this occur ad hoc, right? Like if there is a challenge in a household related to a zoonotic disease, an infection that people are getting and it might be bouncing between people and animals, you'll sometimes see that the veterinarian and the physician work together. But more of these integrated care models are, for example, serving populations suffering from homelessness or other populations that are more difficult to reach. And they literally are models where both services are delivering at the same time and may even share a space in a way that is intentional, right? That there's a piece of the space that's for the veterinary side and a piece of the space that's for the human healthcare delivery side.
That's fascinating to me. It's kind of like a family clinic, but it's for everybody in the family. Is that
exactly
becoming more common?
I think that there's somewhat difficult models from an economic perspective, given that you don't have insurance on the veterinary healthcare side. And so when you see them, they've tended to grow out of initiatives that have also included maybe training of veterinary students or training of medical students.
Yes, there are two clinics that we had the pleasure of speaking to in terms of the veterinarians that spearheaded this One Health clinic idea. And they used that same models where, like Meghan said, they brought in students from the nursing school and veterinary schools, and they were able to set up these ad hoc areas with, the appropriate permits and things of that nature because it's a medical facility, providing very simple example, physical screening for people that would come in while providing very basic physical screening and vaccinations for pets that would come in. And it would, be like a quick check-in. I wouldn't say this is something that is trending wildly. I will say that it's something that we advocate for wildly because it is highly effective. And the feedback that we got from the people that were bringing these types of programs up is that they were always shocked at how many people that were willing to go in and how easily it was to kind of offer these services with the right kind of infrastructure in place in terms of having those human side and the animal side students and collaborators that are overseeing them in place. It wasn't overly challenging and the results were very positive. And so it is a model that I would say is feasible to branch out into and something that I would like to see more of moving forward.
Meghan Davis, Kaitlin Waite, thank you so much for joining me.
Such a pleasure.
Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmon. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.